All right, today we're talking about a condition called SIAD. Now, you've probably never heard of it, but it's one of the most common electrolyte problems doctors see in hospitals. And it all boils down to one simple but really dangerous problem. The body just won't let go of its water. I mean, seriously, think about that for a second. What if your body just lost the ability to get rid of excess water? Every glass of water, every coffee, all the liquid in your food, it just stays put. Your body's internal plumbing is just, well, backed up. What do you think would happen? Well, it leads to this really scary state that's sometimes called water intoxication. And what that really means is your body gets overwhelmed by all that extra fluid. It dilutes the sodium in your blood down to critically low levels, a condition called hyponatremia. And that, my friends, is where the real trouble begins. So let's really dive into the heart of this problem, because this isn't just about feeling a little bit bloated. We're talking about a fundamental and pretty dangerous disruption to your body's chemistry.
And here's the key thing to understand. Hyponatremia doesn't usually mean you're actually low on sodium. No, it means you have way too much water compared to the sodium you have. It's like taking a perfectly good glass of salt water and pouring a gallon of fresh water into it. The salt's still there, but it's so diluted it can't do its job anymore.
So what happens when the fluid outside your cells is so watery? Well, water rushes into your cells to try and balance things out, and that makes them swell up like little balloons. This is bad anywhere, but inside your skull, it's a catastrophe. Your brain is stuck inside a bony box with no room to expand. Swelling brain cells can cause massive pressure, and in the worst cases, something called brain herniation, which is just as devastating as it sounds. Okay, so what on earth is causing the body to hold on to all this water in the first place? To get that, we need to talk about a tiny little hormone that acts like your body's master water switch. And here it is, vasopressin, or ADH for short. The name pretty much says it all. Antidiuretic literally means it stops you from peeing out water. When you're dehydrated, your brain releases it, telling your kidneys, hey, hold on to that water. When you've had enough to drink, the signal stops, and your kidneys let the extra water go. It's a brilliant system. But in SIADH, that brilliant system breaks down. On the left, you've got the normal smart switch. It turns on and off exactly when it should. But with SIADH, you get this situation on the right. The switch is basically stuck in the on position. The body is screaming, we're waterlogged, but the brain just keeps pumping out vasopressin, forcing the kidneys to save more and more water. So what does this actually look and feel like for a person who's going through it? You know, the symptoms can start out surprisingly subtle, but they can quickly escalate into a full-blown medical emergency.
You can see how things progress here. In that mild stage, when sodium is just a little low, it might be something you'd brush off. A headache, a little brain fog. But as the sodium level drops into that moderate range, you start seeing much more serious neurologic signs: confusion, nausea, an unsteady walk. And then, in severe cases, it can lead to seizures, coma, and even stop someone from breathing.
Now, let's just go back to those supposedly mild symptoms for a second. A little trouble concentrating? Doesn't sound too bad, right? Well, think again. Look at this number. That's right. One study found that even mild hyponatremia increased the odds of a patient having a serious fall by almost double. That little bit of brain fog, that slight unsteadiness, translates into a huge risk for getting seriously injured. It's a powerful reminder that there is really no such thing as harmless hyponatremia. So how do we fix this? Thankfully, this isn't guesswork. There's a very clear, very deliberate strategy for restoring that delicate water-sodium balance. But you have to be careful. The whole approach is about caution and control. First, doctors figure out how severe the symptoms are. Is this urgent, or can we go slow? Then they pick a therapy that fits, from just restricting fluids to using powerful medicines. And this third step is absolutely crucial. They have to monitor the patient's sodium levels like a hawk. Because, believe it or not, raising the sodium too fast can cause its own kind of devastating brain injury. It's a true medical balancing act. And this chart really shows how different treatments stack up. Look at fluid restriction, a really common first step. It only worked about 44% of the time. Giving concentrated salt water, or hypertonic saline, was better at 60%. But look at that last bar. A drug called tolvaptan, which directly blocks that stuck water switch we talked about, had a nearly 80% success rate. It's a perfect example of how hitting the root cause of the problem can make a massive difference.
Okay, that was a whirlwind, from swollen brain cells all the way to treatment strategies. So let's just boil it all down to the key things you really need to remember.
So here's the bottom line. First, SIADH happens because there's too much of that water-hoarding hormone, vasopressin. Second, all that extra water leads to diluted sodium, or hyponatremia. Third, the symptoms start small with things like brain fog, but can become life-threatening. And remember, even that mild hyponatremia dramatically increases the risk of falling. Finally, fixing it requires a super careful, tailored approach to get that balance just right.
And that really leaves us with one last question to chew on. When you think about how common some of those early signs are, confusion, mood swings, unsteadiness, especially in older people, it really makes you wonder, doesn't it? Could a hidden water imbalance be the silent culprit behind a lot more problems than we even realize?